Hi, and welcome to the Central Valley Chemical Safety Day. My name is Julie Falkenstein. I'm a public health nurse with Stanislaus County, and I am here to talk to you about masking up for health, both in relationship to protecting your body and your lungs, as well as with COVID. The objectives for this presentation are to talk about how our lungs and our airways work and how masking protects them, what COVID looks like in Stanislaus County right now, how it's impacted Stanislaus County industries, what public health has done working with the businesses in Stanislaus County around COVID-19, and how to keep yourself and your employees safe in a pandemic world. The first topic will be the respiratory system. Here's a picture of your lungs and the major components of your respiratory system. When you take a breath of air, it flows into your mouth or nose. As it moves through your nasal passages, it gets warmed up, humidified, and cleaned. Then it moves to your trachea and then splits off to each lung via the bronchial tubes. From there, it goes into your bronchioles and finally to your alveoli. Your alveoli is where your body gets rid of carbon dioxide and brings in oxygen. Another way to visualize your lungs is to think of broccoli. The stem is your trachea, the branches are the bronchiole tubes and the bronchioles, and the alveoli are the part of the tips of the broccoli that blooms. Alveoli are made up of mesh of tiny blood vessels called capillaries, which let oxygen and carbon dioxide move back and forth. Your lungs are elastic like balloons and have a slippery surface so they don't stick together. The airways have cells that make mucus, a sticky substance that coats the walls of the airways. Other cells in the airways have hair-like structures called cilia. The cilia and the mucus trap germs and other particles that enter your airways when you breathe in air. The cilia then sweep the mucus-coated germs up to the mouth or nose. From there, germs are swallowed, coughed, or sneezed out of the body. When you breathe in things you shouldn't, such as chemical, smoke from fires, and the like, it damages your airway, causing them to be less elastic, so they can't expand like they need to. Tips to keep your lungs healthy include don't smoke or vape and don't be around people who do. Remove pollution from your air. Change your fireplace to something clean burning. Watch home pollutions like air fresheners, mold, pet dander, construction materials, and aerosol products. And keep your air filters clean. Check your home for radon. It's naturally produced and it's the second leading cause of lung cancer. Watch the air pollution levels. Particulates can irritate your lungs and cause breathing problems. Practice good health. Exercise and get vaccinated. Practice good germ control. Wash your hands, cover your coughs, keep your distance from people, and wear a face covering when out in public. And mask up for health. Wear a face covering mask or respirator depending on what you are doing at work or around the home, specifically when you're going out into public around fire smoke and when working with chemicals. Why wear a face covering, mask, or respirator? There are a variety of masks and face coverings on the market. The top two photos are of N95s and other respirators which are specifically fit to the person wearing them. Respirators protect wearers from breathing in hazardous contaminants in the air. Respirators are required equipment for workers performing some jobs. If you are required to use a respirator for your job, you should continue to do so. Disposable face masks on the second row, such as surgical or medical masks, are not respirators and do not protect the wearer from breathing in small particles, gases, or chemicals in the air. Disposable face masks act as a protective barrier to prevent splashes, sprays, large droplets, or splatter from entering the wearer's mouth and nose. The protective quality of disposable face masks varies depending on the type of material used to make the face mask. Disposable face masks also help prevent the wearer from spreading respiratory droplets. Because disposable face masks help prevent the wearer from spreading respiratory droplets, they slow the spread of the virus that causes COVID-19. Wearing them help people who unknowingly have the virus from spreading it to others. Cloth face coverings should cover the nose and below the chin, fit snugly but comfortably against the sides of the face, be secured with ties or ear loops, Include at least 2 layers of fabric. Allow for breathing without restriction. Be able to be laundered and machine dried without damage or change to shape. Masks should be worn by all people 2 years of age and older. Masks should not be worn by children younger than 2 years old, anyone who has trouble breathing, anyone who is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Wearing masks may be difficult for some people with sensory, cognitive, or behavioral issues. If they are unable to wear a mask properly or cannot tolerate a mask, they should not wear one, and adaptations and alternatives should be considered. Evaluation of mask and gaiter materials and structure is ongoing. COVID-19 by the data in Stanislaus County. An epidemiological curve is a curve that shows the level of disease in a community over time. In this case, we're looking at COVID-19 by specimen collection date within Stanislaus County. You can see at the very beginning how we did not have a lot of cases in the community. And then in time, the beginning of June, our cases started to rise fairly dramatically. They peaked at in the middle of July and then decreased through August until the beginning of September, when they seemed to level out for a period, although they did not reach, again, the levels of infection that we saw before our June spike. You can see that in the beginning of September, in the beginning of November, we started to have an increase in cases again. At this point, our cases are increasing faster than they did in June when our numbers went up the first time. This slide looks at COVID by age over time. So we're looking at the same time period, however, we're looking at 7 different age groups. The light blue line is 0 to 17. The orange line is our 18 to 24. The 25 through 34 are in our gray line, which you can see peaked in with our last peak. 35 to 44 is in yellow, which is close behind our 25 to 34 group. 45 to 54 is our light blue line here, and again over here. 55 to 64 is our green line, which is actually one of our lower lines here. And then our 65 plus is this dark blue line that you can see that is just above our youngest age group. This lets us see how and which groups are being impacted by the COVID infection. This slide specifically looks at race ethnicity and the disparity between different race ethnicities in the COVID infection. You can see that in our first big spike that our Hispanic population disproportionately experienced the COVID-19 infections. Our non-Hispanic whites were kind of in the middle to the lower end of who was impacted by infection. Our non-Hispanic Asian population has been kind of right in the middle of the line. The gray line that you can see here is our non-Hispanic Black or African American population. During our first spike, we saw a fairly large disparity between our Hispanic population and the rest of Stanislaus County. It appears going into this spike that our race ethnicity groups are more closely joined together as this spike is occurring. COVID by gender is a very interesting mix. We see that women are much more likely to be infected with COVID and be tested and diagnosed than men are. COVID-19 and its impact on Stanislaus County industry. You may want to pause the presentation and take a look at this slide in more detail. It shows you outbreak by facility type over time by month. And so you can see that where we had our outbreaks changed over time. In March, there was one in a meat processing plant. And then we moved in April to a shelter and into a grocery store. In June, we had a big spike in other, um, which is everything that isn't listed out there on the right hand side, the left hand side, I'm sorry, of the screen. This might be another slide where you want to pause and take a minute to look through it. This is industries impacted by numbers as far as the number of infections within each industry area. It is ranked across the bottom here, the same way that it comes down this way, so that we had our most infections in warehouses and our least number of infections within first responders and hotels. Stanislaus Public Health's work with industry during COVID-19. As the pandemic started, public health reached out to different industry groups and helped devise plans to prevent the spread of COVID within the worksite. We reached out to provide resources and training, to review worksite work plans, and to provide clearance guidelines for return to work after an employee was sick. Worksite outreach has continued during the pandemic. We contact employers about positive tests within their employee population. We assist with contact tracing and gathering a line list, which is a list of people who are close contacts to a positive case. We provide isolation and quarantine guidelines for staff. We have many essential businesses and industries within Stanislaus County, and we work to provide exemptions to those employers so that their work can continue. Because it's important to keep our businesses open in Stanislaus County, Public Health provides technical assistance over the phone. We provide assistance with interpreting industry guidance and talking through how it should be implemented. We provide site visits and walkthroughs and work with employers on what they need to do to structurally change the environment to make things safer. We also will go out and provide educational sessions for employees. This includes about a 20-minute class that employees can attend that talks about how COVID is spread, what the workers' responsibilities are, what the employer's responsibilities are, and how people can protect themselves. This next section, Keeping Yourself and Employees Safe in the COVID-19 Pandemic, is a sample of the education sessions that we can provide to employers and employees. COVID is spread between close contacts when droplets of saliva or discharge from an infected person go to a non-infected person. They enter the non-infected person through the nose, mouth, eyes, inhaled, or transferred from contaminated surfaces. Spread from contaminated surfaces is rare, but please use hand sanitizer anyway after you have touched a commonly used item. Close contacts are people who either live with the person who is positive or who are closer than 6 feet to them for more than 15 minutes cumulative over a 24-hour period. Knowing the symptoms of COVID-19 is important. More important is to know that people can have COVID-19 and not have any symptoms. It's estimated that 47% of people who have COVID-19 are asymptomatic, which means they don't have symptoms and they don't know they have COVID. Symptoms of COVID include a fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, a headache, new loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Symptoms typically appear between 2 and 14 days after exposure to someone who's positive with COVID-19. Protecting yourself and others in the workplace is a responsibility of everyone. People should wash their hands often with soap and water for at least 20 seconds. They should do this before eating, after using the bathroom, after handling or touching their mask, blowing their nose, coughing or sneezing, or using a commonly used item like a vending machine. The use of alcohol-based hand sanitizers that's at least 60% alcohol is an option if soap and water aren't available. Masks should be worn correctly at all times, except for when eating and drinking. A correctly worn mask covers both the nose and the mouth and fits against the face. People should practice social distancing, staying at least 6 feet apart from others. Handshaking is something that should no longer occur, although an elbow bump is certainly an option. Don't touch your eyes, nose, and mouth because those are common areas for germs to enter the body. Clean and disinfect all frequently touched objects and surfaces, including all work surfaces. So things like lunch tables, the front of a vending machine, a copy machine, all should be wiped down frequently between people's using them. Avoid using your coworkers' equipment. Don't share phones or other specialized equipment in a workplace. Avoid carpooling. If it's not possible to do that, then make sure to wear a mask and roll down all the windows for better circulation. Increasing ventilation is an important way to dilute the virus within an environment. Meeting together outside is always safer than meeting together inside. A close contact is someone who is closer than 6 feet away from a positive person for more than 15 minutes over a 24-hour period, or it is someone who lives in the household with the positive person. If you are a close contact, it's important that you test for COVID-19 between days 5 and 7 and 11 and 14 after your last known exposure. This helps show you whether or not you have contracted COVID as well. It's important to stay in quarantine until negative test results are received. If positive test results are received, then see the instructions for a positive case. If you develop symptoms of COVID-19, you need to make sure that you stay home and notify your employer immediately. It's a good idea to separate yourself from others in your household. If there's a master bedroom with its own attached bathroom that is separated from everyone else, that's a good place to stay. Having someone else in the house leave food for you outside your door so that you're not interacting with people in the house. Get tested for COVID-19 and stay in quarantine until the test results are received and you know whether or not you're actually positive for COVID-19. Quarantine can be a confusing time for people, particularly those in essential industries. To quarantine means that you've been exposed to COVID and you need to stay away from other people so that if you become positive, you don't spread COVID to the others around you. So what this means is that you do stay home. You socially distance from household members. If you can move into a master bedroom with its own bathroom and stay isolated in that area away from household members, that's always good. It's the best. You should wear a mask when you are out in the main part of the home, and you need to be disinfecting frequently touched surfaces. It means that you don't have visitors over. You don't gather with people. You don't go out and go grocery shopping or pick up drive-through. You can test during your quarantine period. However, you can't test out of quarantine. So we recommend testing between 5 and 7 days and then again between 11 and 14 days because that shows whether or not you've converted to having the disease. However, negative test at 5 to 7 days doesn't mean that you get to quit quarantine early. It just means that you haven't yet become a positive case. By the time you test between 11 and 14 days, if you continue to be asymptomatic, you don't have to quarantine after 14 days while you wait for your test result. You can find testing throughout Stanislaus County. Free testing can be located at stancounty.com/coronavirus. We have locations permanently in Turlock, Modesto, and Salida. You can also reach out to your primary care provider, your local pharmacy, or the urgent care in your neighborhood. If you have a positive test for COVID-19, you need to start by isolating at home for 10 days after your symptoms started or you had your test that resulted in the positive results. If possible, you want to stay with your own bedroom and bathroom. You don't want to share those with the rest of your household. You want to keep doing what you were doing during quarantine, but much stricter so that you make sure you don't pass COVID to your household members. You want to wait for a call from public health. We'll call from either a 209 area code or a 916 area code if the state is helping us. Investigators will identify themselves and that they're calling from Stanislaus County Public Health. They will ask you to confirm your birthday before they talk to you about anything. And that's so that we can verify that we're talking to you and not to someone else. We will not ask for your social security number or your bank account information. We will never ask you for money. We will ask you questions about what you've done for the last 14 days, and we will ask for the contact information of everyone that you have been around. Be sure and let the people that you were around know that you tested positive for COVID-19. You're infectious for 48 hours or 2 days before you become symptomatic or tested positive. So it's important that you reach out to those people that you saw during that time period and until you were able to start isolation so that they know they should be quarantining at home and watching for symptoms themselves. Talk to your employer or the HR department about California State Law SB 1159. You may be eligible for compensation if you are under a local isolation or quarantine order related to COVID-19 infection. Resources are also available to help you isolate at home. If you let the investigator who calls you know, we can set you up with a grocery delivery or pharmacy delivery or a variety of other things if you need help in your household and so that you can safely quarantine. So that you can safely isolate. You can return to work and resume your normal life 10 days after your symptoms started with COVID-19. So you will have needed to complete your 10 days of isolation. You need to not have a fever for at least 24 hours without fever-reducing medication, such as Tylenol or ibuprofen, acetaminophen, or Advil, and that you have an overall improvement in symptoms. So you're feeling better at the end of the 10 days than you necessarily did at the beginning of the 10 days. It's normal for a cough to remain after you're no longer infectious. It's important for you to continue to wear a mask during that time. Public health does not recommend a negative test to return to work. You are very possibly going to continue to test positive for COVID-19 for up to 3 months after you've had the illness. So retesting to go back to work doesn't work well if your goal is to return to work after 10 days. It's really important that people know that to wear a face covering when they're at work or in public places, that people watch their distance and they're keeping at least 6 feet away from other people who aren't in their household, that you wash your hands and use hand sanitizer if you don't have access to soap and water, and most importantly, that you stay home if you're sick. These are key things to keep in mind as we work to decrease the spread of COVID-19 in Stanislaus County. If you have questions about COVID-19 in your community or how your public health department is working with industry, please feel free to reach out and call your local public health department. County numbers are listed on this slide. Each county has different processes, so it's important to call the county where you're located or where your employer is located. Thank you so much for taking the time to watch this publication. Enjoy the rest of your time at the chemical safety education activities. Thank you.